Load. What does it mean? When do we start it? These are the important questions that we have today. Cody.
Well, Load is not just a bad Metallica album. It's very important for us to be able to scale and determine when somebody can do something appropriately. So some obvious ones: post-surgical, somebody's coming immediately out of ACL reconstruction, spinal fusion, rotator cuff repairs. You're not going to squat, bend over, shoulder press immediately afterwards. So being able to determine what sort of stress, strain, effort, let's all lump that into load,
Sure.
is most appropriate for some of the stuff. We will oftentimes, I'll keep the post-surgical thing rolling. You'll have certain precautions, and those are in place to
Manage load.
manage load. But in other cases, physical therapy has a history of chronically underloading and not doing enough to manage patients who maybe have been dealing with long-term issues or more acute issues, and being able to find the right level of load, whether that's sets and reps on an exercise or holds in a stretch or positions, that can go a long way.
So classically, if we're thinking load, we're thinking weights, we're thinking dumbbells, barbells. That's also gravity, right? Load is also gravity. Load is also volume of a run. Load can also be your children, right? If you're postpartum, classically don't pick up an X amount of weight, and just kidding, you have 3 toddlers at home already. So that is a load that we're managing.
Yes.
So when it comes to patients walking in the door, they have, let's say we're going to flip the script of the post-op. Now we're chronic, 6 months, 12 months history of this thing. How are we managing load, and how quickly are you loading those people up, and what are you talking to them about in terms of like symptom response and what they might feel and how they mentally might feel about it?
I do a big conversation about spectrum, so I'll use a line on the top.
The
of
internet
this here.
service?
No, not anymore. So usually what happens when a person comes is, let's say you take the runner, for example, exercise, primary thing that bothers whatever the problem is. So you have an activity that has a certain amount of load that they're not putting up with. The tissue's not putting up with it. So you go through all your stuff, you figure out your plan to try to get that person to put up with it. But at the end of the day, they have to be able to tolerate the load of the activity they want to get back to doing. So you have to understand the level of irritability of where the injury is, because that's going to dictate where on the spectrum. Like if this is 0% tolerance, this is back to 100%, they're somewhere on that. Their anxiety and phobia of their injury plays also a role on this, because people who are maybe holding themselves back because they're too fearful of what it's going to feel like, they might actually be higher on the spectrum than they realize. So they're down there. On the flip side, when you get somebody who's like really ready to go, sometimes they might do a little bit more than what they are on the spectrum, and they overload or they go beyond what tissue tolerance is. So kind of getting back to your point of like what this is going to feel like. I don't personally like to take someone down to 0 if they don't have to, because that's just a bigger journey to have to get back to what they want to do. So I try to really get to the heart of like, where can we slide roll this loading commentary? So like, go run, but here's a couple things to think about. I'm not a fan of doing something abnormal. So if you can run normally and you can appreciate that you're not favoring or doing something differently, whatever that activity is, then that's good, because you're loading it naturally. So that'd be kind of like, can you do it normally? If that starts to taper, you start favoring. Maybe we're starting to get a little bit beyond that. So that might be your sign to cut. So whatever that distance or time is, I don't care, but can you move? I'm also not a fan of slowing down, like run your normal pace. So, because slowing down is favoring. If you don't need to slow down, don't slow down, but respect when it starts to feel different. I'd say I'm also a big 24-hour rule fan. So what happens the rest of the day, what happens at night, what happens the next morning, those are all responses to the tissue that you loaded. And bottom line, if you recover and your slate goes back to 0, that was kind of a win, and I would take that. So
I think part of our mantra here is don't load too fast Don't unload without a plan. And I think that's probably where we see a lot of failure, honestly, is you're chopping that load down to zero, you're resting, you're like, I'm gonna wait and see what happens. And then 2 weeks go by and you're like, whoop, all the way back, and yeah, nothing changed. So we didn't negotiate the load in any way, shape, or form. We just took some time off and maybe some tissue calmed down, but as soon as you took that load back up, you're back to where you started.
Well, and it's that the patient has to understand that you're loading something that's healing. It's not going to feel perfect. Like, that's good. That's actually good. You kind of want to feel something and respect what it feels like. So
Yeah, 100%. Like, that's a huge part of it is you will feel things. We are stressing your injury with this load. And I think another thing too is we are in a unique position where we can help people to quantify what are appropriate timeframes for feeling the things. The 24-hour area that you're discussing is key. You can get a sense of break that 24 hours up even into 4, 6, 8-hour chunks. How does let's use a knee as an example. Like, how does your ACL reconstruction, does it swell up after you've tried your run? Like, are you having all of this new joint stiffness when you go to bed, when you wake up? Does it wake you up at night? Are you waking up the next day with a limp? Like, those could be signs of too much. Conversely, everything feels great. I didn't feel like I did anything. Okay, well, get ready. We're going to try a little bit more next time.
You heard it here. You're going to feel something.